Hi! A good and prosperous day to my fellow MedTech students. I am Ruby Shelo B. Licom, your acting guru for today. The topic for this day's discussion is a quick overview on the practice of phlebotomy. As we go along to this session, we must be able to first identify what is phlebotomy and the key terms involving phlebotomy procedure. Second, explain the basic supplies and equipments used in doing venipuncture and exhibit the proper and safe usage of it. And third, lastly, we must be able to perform venipuncture. So let us start first in identifying our topic, which is phlebotomy. So ate, what is phlebotomy? Phlebotomy is the act of drawing or removing blood from the circulatory system through incision or puncture. It could be a venipuncture or cut through the veins, or a capillary puncture or cut through the capillaries. Today, we will be focusing on venipuncture. So, the location on where venipuncture is performed is in the antecubital fossa, which is inside of the elbow. There are three veins that a phlebotomist can choose, which namely cephalic, basilic, and median cubital vein. The most commonly used vein is in the medial cubital vein. So it is found here in the middle, since it's middle. Since it is superficial, meaning it is in the surface of the skin, and serve as anastomosis between cephalic and basilic veins, meaning that cephalic and basilic are connected to the elbow by the median cubital vein. Now, we already know what is phlebotomy and where to perform it. Therefore, our next thing to tackle is how to do it. First things first, we must identify the supplies and equipments that we will be needing. I have here with me my phlebotomy kit. This kit has a lot more than what we will be needing for this lecture, so I will not be expounding on that anymore, but rather be introducing you those equipments that will only be necessary for today. This includes gloves and alcohol for the phlebotomist's personal protective equipment. Note that in a laboratory setting, mask and laboratory gown will also be necessary. Next is a tourniquet. So this tourniquet will squeeze the blood vessels of the patient for the phlebotomist to determine the location of a suitable vein for venipuncture. Then an alcohol prep pad. An alcohol prep pad, or simply cotton with alcohol, will be able to cleanse the area where the venipuncture will be done. Next is a needle. A needle which will of course collect the blood from the veins. Note that there are a wide range of needle starting from the needle type to gauge size and volume. So here I have here a 5 ml gauge 23 type of syringe. Next is a tube. So this tube is where we will deposit the extracted blood. Again, note that there are different types of tubes in the laboratory setting, but that is another story. So today I'll be using a red top tube, glass vacutainer, which has no clot activators, no anticoagulants, no preservatives, and no separator materials. In short, no nothing. Next is lastly a tape, specifically micropore, and dry cotton that comes hand in hand with each other. So this is used for covering the puncture. Now, allow me to demonstrate to you guys for better understanding. I have here a bottle of mine that I will be used as the forearm of the patient for this demonstration. First off, make sure your hands are clean by washing hands properly and applying alcohol. Then, properly don your gloves. Both hands. Next is the application of our tourniquet. So we will be doing this twice. First is for locating the vein, and next is when we will be performing the venipuncture. So I will perform the tourniquet application to this bottle. So, when doing the tourniquet application, do not forget to put the patient's hand into fist form when the tourniquet is applied. So, when you apply the tourniquet, you must ask the patient to form their hands into a fist form. So, there is no really certain step to do it, as long as you can have your own strategy, as long as it is 2 to 3 inches above the antecubital fossa. So it is 2 to 3 inches above the antecubital fossa. Let's say that in this bottle of mine, this is the water level is the antecubital fossa, so it should be 2 to 3 inches above it. Then not placed in a crumple way. So as you can see, it is placed clean. And most importantly, is easy to pull once the venipuncture is done. So once the venipuncture is done, this is easy to pull out like this. That should how you apply the tourniquet. So after placing the tourniquet, you should locate the possible vein where you should perform the venipuncture, then release it. So after releasing it, so you have released the tourniquet already and located the vein where you will do the venipuncture. Clean the area where you will do the venipuncture using the alcohol prep pad. So this is the inside of an alcohol prep pad. You should clean it in a circular motion like this. After cleaning the area where you will do the venipuncture, we can now put back again for the second time the tourniquet and prepare our syringe. So this is our syringe. We must prepare it first. Then do what they call as anchoring, which means pulling down the skin from below the intended puncture site using the tongue. So if this is the intended puncture site, you should pull the skin downward towards the wrist. So this is used to put the vein in place and prevent it from moving. So when you do the anchoring, you can now aim the syringe to the vein with the bevel facing you, the phlebotomist, in a 15 to 30 degrees angle manner. So when you do it on hand, let's say this is where our tourniquet is, you should anchor downward, then aim the syringe. This is closed, by the way, so it's safe. Aim it with the bevel facing the phlebotomist. The bevel is the opening of the syringe, so remember to face the bevel towards you, the phlebotomist, when doing the venipuncture to the patient. So once you are ready, ask the patient to take a deep breath and now insert the syringe into the lumen of the vein. So before inserting it, ask the patient to take a deep breath. Okay. There is another part in the syringe that you should have to take take note, and that is the hub. This is the hub part of the syringe. So once that there is a blood in the hub of the syringe, it will automatically indicate that you have hit the vein and is now ready to be plunged out. So note that before pulling the plunger, release the tourniquet first. So once there is blood, release the tourniquet, then pull the plunger until the barrel is full or until you have reached the desired volume of blood you needed. Once done filling the barrel with blood, put the cotton with micropore on the site of the venipuncture before pulling the syringe out. Apply a minimal amount of pressure to stop the bleeding and secure it with a micropore. So now the syringe with blood is ready to be placed in the tube. Since I am using a vacutainer tube, this type, just simply inject the syringe into the tube and the blood will be transferred automatically. Now, after doing so, secure the syringe by placing back the protective cover, this protective cover, by recapping. Always note that you should not recap while holding the cap because of the hazard it will give. To recap it by inserting the syringe into the cup. So, as per my strategy, at the start of my venipuncture, I place the cup of the syringe inside the micropore. Here. So, it will be in a standing position, which will make it easier for me to seal the syringe back. So, when I'm done doing the venipuncture, I will just insert the syringe to the cap this way without holding the cap. As a phlebotomist, you must always have what they call the yellow bag. So this yellow bag indicates for biohazard waste. So it is purposely used for the disposal of clinical wastes. Doing all this procedure will yield us to a tube with our blood. So don't forget to label it properly. As what is being asked in the tube, and safely place it to where it won't be a hazard from anyone. Since I am the only one here who can volunteer in doing this task, I am glad to show you guys how I self-venipuncture, but please be advised that this is done with enough learning and practice. If you think you don't have that ability yet, I am not requiring you to do so. So some steps indicated here in this video cannot be followed precisely anymore since I will be short in hand as my other hand will be used for the venipuncture side. As you go along with this instruction, there are a lot of things that might happen and you may encounter situations like probing, corrective action, and fishing and the likes. But since I am introducing the basics of phlebotomy, I won't be able to decipher those anymore. Just remember that enough learning will help us in doing this task, and that enough may not only be coming from me, but to other sources too. So that is all about my instructional video. Again, this is Ruby Shalobilikong from 2CMT3. Thank you for listening, and goodbye!